So let's move on to the ligaments of the foot and ankle. So we'll talk about the ligaments. So now there are a lot of ways to describe the mechanism of injury to the ankle, because as you all know, there are many different bones of the foot and ankle. There are many different motions that can occur because of all the articulations there. One of the common ways of describing the mechanism of injury is if you have the mechanism primarily foot supination and talus external rotation, which is called SER mechanism of injury. Another one you can have is foot pronation, talus abduction, called pronation abduction, PAB. You can have foot pronation, talus external rotation, which is PER, and foot supination, talus adduction, which is called SAD or SAD. So now foot supination, if we're talking about looking at the right foot, a pronated ankle or foot and ankle is where the talus angulates laterally. So you basically have hindfoot valgus in this type of injury. I mean, this would be the mechanism, is places the calcaneus and valgus are external. Normal, you've got everything in the midline, and supination of the hindfoot is where the hindfoot goes into varus here. So if you take the foot and you angle it so that the foot sticks out to the rotates toward the lateral side, that's pronation. If it rotates toward the medial side inside, then it's supinated. Okay, so that's foot supination and pronation. So mechanism of injury. So with the SER, it's what you have is, let me just go back here. SER, you're going to have foot supination and talus external rotation. So you're going to have the calcaneus angle medially, and then you're going to have rotation, external rotation of the talus. So the talus is going to externally rotate. So when you have this kind of a mechanism of injury, you tear the anterior talofibular ligament, usually the fibulocalcaneal ligament as well, and then depending upon how extensive it is, you can also tear the medial deltoid. So we see this kind of mechanism a lot. In this. So this is a supinated injury to the foot. The pronated injury, which we have, is more external rotation. In this kind of injury, you get this pressure on from the calcanea, the talus, onto the distal fibula, producing this oblique fracture and the distal fibular metaphysis. And would tend to also get, you can get fractures on the medial side of the talus, and you can get the ligamentous injuries, the anterior inferior fibular, and the basically the syndesmotic ligaments, the anterior tibiofibular and the posterior inferior tibiofibular ligaments. Some people call these extension injuries. So these are two of the most common injuries. The PER tends to involve be a high ankle sprain, the common high ankle sprain. The SER is a common lower ankle strain where you get tears of the anterior talofibular ligament, fibulocalcaneal ligament, and deep deltoid, which we see all the time. And then there's the SAD injuries, where you basically have, again, a supination injury. You get an oblique fracture of the medial malleolus and a transverse fracture involving the distal fibula. And then you have the pronated fractures where you can get an oblique fracture of the distal fibula, and then often displacement and an avulsion fracture, transverse avulsion fracture involving the medial malleolus. And so these are the four classic type injuries that often the surgeon would like to know concerning mechanism of injuries, because it helps them anticipate where the injury is going to be. With MR, we can directly look at the location of the different injuries. I fall a little bit short. I usually don't say the mechanism of injuries. I try to describe the areas of injuries, tears and fractures, and the obliquity of the fracture to help the surgeon then decide which of these four it is, and then that then helps them determine what kind of surgery they're going to have to fix it. But I don't actually put it into one of these four categories myself, because I think this is often, we can help them by showing them where the injuries are, but this is often due to the mechanism of injury, where they go over with the patient what happened at the time of the injury. So in terms of incidence, this is a paper in Skeletal Radiology where they looked at 277 patients who came in. By far the most common was SER, which is also what we see, tear of the anterior talofibular ligament, the fibulocalcaneal ligament, and the deep deltoid. And then you can have associated, as you all know, associated injuries of the talar dome and other bones, depending upon the severity of the force. And then the PAB and the SAD were similar, and the PER is the least common. So let's go. We'll talk about the ligaments. We'll start with the lateral ligaments, and we'll talk about medial, posterior, sinus tarsi, and Lisfranc. The lateral ligaments are the anterior and posterior talofibular, the lateral anterior posterior tibiofibular, calcaneofibular, calcaneonavicular, and then the interosseous ligament of the sinus tarsi. So looking at these posteriorly, we can see the posterior talofibular ligament back here. Here's the fibulocalcaneal ligament coming down here. There's a transverse ligament, and then the posterior tibiofibular ligaments back here inferiorly. Anteriorly, we can see the anterior talofibular ligament, fibulocalcaneal ligament coming down here, and the anterior tibiofibular ligaments. The syndesmotic ligaments are between the two bones here, and we'll talk about those in high ankle sprains as well. If we look at an MR examination, up at the level of the top of the talar dome, we can see the anterior inferior tibiofibular and the posterior tibiofibular ligaments, the anterior talofibular ligaments, posterior talofibular ligaments. I'm very familiar with this, so I don't think we need to spend a lot of time on it. Tears, this is a typical tear of the anterior talofibular ligament. In this case, it's the ligament itself is severely injured diffusely, and we have an avulsion of the anterior talofibular ligament from the talus, as we can see here. So knowing this is probably going to be, we come back over here, an SER type injury. We know that we can then look for other injuries. We'd look for deep deltoid injuries, and with this would also, with all of these injuries to the ankle that may make the mortise joint unstable, you have to look for acute osteochondral injuries of the medial and lateral aspect of the talar dome. Okay, so this is anterior talofibular ligament tear. And here's just another example of another tear of the anterior talofibular ligament avulsed from the talus. Okay, I don't remember who is next. Elior, why don't you take this one?
Okay, so looking in the area of the anterior talofibular ligament, not seeing it well and concerned for a tear. Let's see, I think we're looking at the Hmm. I'm not sure. Are we looking at the deltoid ligament here or? Okay.
Okay, so this has an oblique fracture of the medial malleolus. So let's go back to our mechanisms of injury. What was that? So with something like that, we're going to have probably a supination injury where the talus and the calcaneus rotate medially, putting pressure on the medial malleolus, which produces the oblique fracture of the base of the medial malleolus, and then avulsion injuries of the lateral ligaments. And this is really then fits nicely in here about the PAB, which is a pronation type injury. I'm sorry, yeah, pronation and injury. Let me go back and make sure I remember what I was talking about. Yeah, I'm sorry, that's the medial side. Sorry about that. My error. So this is really more of an oblique fracture on the medial side, uh, which is going to be this injury. So this is going to be, and this is going to be a supination injury where the talus and the calcaneus rotate medially, which produces the oblique fracture of the medial malleolus and avulsion injury to either the ligaments or the bone laterally. So this would be one of the SAD type injuries. Uh, so uh, some people, instead of using the surgical classification, would call this an inversion type injury, whereas if you have an oblique fracture of the distal fibula, it would be an eversion type injury. That's a different classification system, but the surgeons most of the time use this other classification system where you use the term pronation and supination. Okay. So when you have this inversion type injury or a supination injury with an anterior talofibular ligament tear and medial malleolar fracture, you often will get lateral talar impaction. Posterior malleolar fractures are commonly associated with this type of injury. Sinus tarsi ligament tears are also common. You can get either a fibular avulsion fracture or tears of the ligaments. Articular cartilage injuries are common. You can also get anterolateral impingement that we'll talk about later. And the common peroneal nerve can also be injured with this kind of mechanism of disease, of injury. Let's see, who's next? Okay, Robert.
I think it's me. Here it looks like there's a complete tear of that ATFL.
Okay. And here are the coronal images.
Also some edema in that medial malleolus.
Right. Okay. So, kind of what do you think the mechanism of injury is going to be here?
Uh, Another, I guess, inversion injury.
Yeah, so it's going to be another inversion injury. Uh, and again, if we go back here, uh, the inversion type injury is a supination injury, whereas the eversion type injury is a pronation injury. So this would be a supination type injury. And there we can see tears, and here we can see the injury to the medial malleolus that you would expect. And then here we're also seeing a tear here of the periosteal attachments here medially. And we can see an impaction injury here impacting the medial aspect of the talus with the medial malleolus. And so this would be an inversion type injury, right? Okay. Tayson.
All right. Arrow points to a complete tear of the ATFL.
Okay. So this patient had an ATF tear. This was on 1604. The patient came back 6 months later, and this is what it looked like.
It's like it's scarred back down.
Right.
Pretty intact now.
Yeah, and you can see that it's thickened, which is, as we all know, is an indication that this patient likely had a prior injury that is healed. Now, back when I was a kid, these were often treated by surgery. Now, these are very rarely treated by surgery. These tend to scar down and heal very nicely, well, without the need of surgery. I have surgeries in both of my ankles from injuring the anterior talofibular ligament as a teenager playing basketball. But that's why we say when you see thickening of the ligament, that's most likely indicating an old injury which is healed, scarred down and healed. Okay, Oleg.
We have stuck on both sides. So we have,
So we have a skin marker here.
okay, so this is the
Here's the fibula.
lateral, lateral
Okay.
malleolus, so there is a fracture of the lateral
Okay.
malleolus.
So here's the growth plate here. It's
Growth plate.
near fusion, growth
Mhm.
plates. And then you're right, here's a fracture of
Fracture.
the distal tip with a lot of edema within the lateral malleolus.
Mhm.
If you go to the axial images, what do you see here?
Um, uh,
So
trying
here's
to
that marker
try,
again.
yeah,
So
yeah,
what's
I see that. So it's I mean, again, fracture. I mean, I just
Okay,
don't
this
know
is the
what.
same page. So this is a fracture, but notice there's a lot of signal loss here in the bone, a lot of eburnation in the margins, and this is a chronic avulsion injury. And this is the kind of injury that can lead to the os fibulari that we were talking about before.
Okay.
And this page, and then so this is a chronic fracture, and at this point, depending on how old it is, it could be a non-union or just a fibrous union between the fracture fragment and the base of the lateral malleolus. And then here's just an os fibulari, and here we can see it's located in this location, but notice how flat the distal end of the fibula is. This is a chronic avulsion injury that's displaced and has not healed. And here we can see the chronic fracture, and these are often somewhat unstable, leading to chronic instability of the lateral portion of the ankle. So I don't like to think of these as being a normal variant, because I think the vast majority of these are actually non-united avulsed fractures, which tends to be an indication of instability. So why don't we stop here, and we'll pick up at this point tomorrow. Okay?
Thank you.
Thank you.
Thanks.